Hey guys, great to see you. I'm Stephen McInday and this is...
I'm Dr. Daniel Gordon.
So, Dr. Daniel Gordon, I've got the pleasure of inviting Dr. Daniel Gordon to come and speak to me today about a very interesting subject. So we get loads of people coming into the clinic who suffer with back pain. They're often quite worried about the kind of symptoms that they're getting. And the reason they're worried is because there's tons of stuff out there on the internet, and reading around some of this stuff, it can get a bit worrying, can't it?
Yeah, absolutely. I think the problem is with the internet is you can just read limitless amounts of information but never actually know what to take seriously.
Good. So I thought I'd bring the big dogs in to talk to you about some of the red flags associated with lower back pain. So this video is particularly, the key subject is talking about red flags. So red flags, how do you describe those to a patient?
So I would say a red flag is something that makes a doctor worry about you. So, most causes of back pain might be muscular, it might be mild, but there might be one or two things which, when you're speaking to a doctor, it will make the doctor's ears prick up and suddenly think, well, this is something we've got to take more seriously, maybe investigate more kind of quickly.
Great. And when you talk about red flags with a patient or a client, obviously they might get a bit worried by some of that, and certainly some of you at home that listen to this video might get a bit worried when you hear about some of these symptoms, but I would say, in terms of my advice to you, would be to not worry, to contact someone who knows what they're talking about, who can assess you alongside the red flags, because often the red flags, you may actually be worried more so than necessary, but going to speak to a specialist about the red flag would be the first port of call. Wouldn't you agree?
Yeah, I completely agree. A red flag doesn't mean it's something sinister, it's just a symptom that would make us take closer attention to you.
Great, good. So what would you say your top red flags are that you'd be looking for when you're in private practice?
So I think the most important one for back pain is always neurological symptoms in your legs.
Okay.
That's a sign that the spinal cord, the damage may be compressing the spinal cord. So if you're feeling weak or numb in your legs, and also that the compression of the spinal cord can also act on the nerves which go to your bladder and to your genitals. So if you're unable to hold urine, or if you're leaking urine, and the same with your stools as well, or if you're getting numb around the genitals, that's always a critical sign that you need to be seen extremely soon with back pain.
Great. So one of the more light-hearted sides of the numb legs is when people have been sat on the toilet for a very long time. Have you experienced that?
Yeah. So absolutely, but it's not the same as that. It's kind of, I guess what I would say is that it's a persistent numbness or a persistent weakness in one or both of your legs.
Good. So it is very different from when you've been sat on the toilet for too long, reading the Men's Health magazine, as we often do. Not together, of course. But if you are sat on the toilet for a long time, you've got the pressure on the sciatic nerve in the back of your leg. That's effectively the symptom that you might experience from the constant pressure on your leg. But what Dr. Daniel Gordon is talking about is more when you've got back pain associated with this persistent pain down the leg, and you've got these other features. So the bowel or bladder sensation changes, the numbness or the pins and needles in the genital or anal region. They're all a bit more worrying symptoms, and they're something that you might want to go and see a healthcare provider about, either a physiotherapist or, more importantly, your doctor, who's going to be able to take appropriate action and then send you to see the right person to get that investigated, or probably more often than not, watch it and observe it over a period of time to see how that kind of transpires.
Yeah, I agree. I mean, I think if you had those symptoms in your genitals or legs, I think the doctor would be sending you straight away for pictures, for some kind of imaging, like an MRI scan. But there are other red flags which you might treat slightly differently. So, for example, one of the red flags is extremes of age. So if you're a really young person or a child, or a really kind of, or more kind of older end of the scale, that's slightly less typical, but it doesn't mean that a doctor would immediately send you somewhere, but they might pay a little bit more attention to whether there's an underlying cause to your back pain.
Yeah, that's fantastic, great. So what other kind of red flags would you see in clinic, and how common are they when you see them?
So I guess the other red flags are things like I mentioned, extremes of age. The other one is if you're having any weight loss or fevers at night as well. And I think those are kind of the most important ones for a GP. I think the other important one is trauma. If you've had a significant trauma, which may indicate actually that you've broken something or kind of significantly damaged something in your lower back. Those are kind of the I'd say the core ones. Yeah. They're pretty rare to see in practice actually, because the vast majority of back pain is kind of musculoskeletal or comes from the discs. and the nerve. So they are rare, and that's why we call them red flags, because it's something that should make us pay extra attention to the patient.
Exactly. So we see a lot of clients in clinic that suffer with night sweating or night pains. Now, one of the common misconceptions is that people might be getting this related to other things that are happening inside their body. So I know when you reach a certain age and you're a certain gender, as in post-perimenopausal women, for example, well, menopause can occur in different ages, but typically it's around 40, 45,
around 50.
50 now. Wow, great. So we see early premenopausal women in clinic, but typically around the age of 50, women may suffer with night sweats as well. Yeah. So that wouldn't count as a red flag, would it necessarily?
No, absolutely. And I think that's what you've illustrated there is the importance of having a doctor assess your red flags, because it's very easy to Google, to look at these symptoms and to immediately worry that it applies to you, whereas in actual fact an experienced doctor will be able to tease out whether there's anything that's actually applies to you, or whether it's something to do with something else like menopause or another medical condition.
Yeah. So if it's approaching summer and you're getting night sweats, then probably start by opening the window. Don't rush to your doctor and worry about night sweats so much. But if you do have any of these symptoms and you do want to speak to someone, then Dr. Daniel Gordon has left his information just here. And he's available on email and to have consultations with. And you can always contact us in the box below and leave your details for us, and we can pass that on to Dr. Daniel Gordon. And he's more than happy to speak to you if you'd like some more information. You can always contact the friendly chaps at Perfect Balance Clinic, and you can also leave your details below for that. And if you'd like any further advice or any information about that, then we're always happy to help you and guide you towards the best sources of information, or speak to you ourselves. So hopefully that's been helpful, and you've learned a little bit more about red flags and when to start thinking about when you should come and see someone to get a bit more advice than Google might be able to provide for you. But it's been fantastic talking to you, and it's been fantastic talking to you today. Thank you very much.
Stephen. Thank you.
But for now, it's bye-bye from me, and
bye-bye from me.
Take care.
Bye.